Hi, my name is Richard Quartarone. I'm with the Immunization Services Division at the Centers for Disease Control and Prevention in the United States. I have a background in communication, journalism, science communication, public health, state, local, and federal level. And I'm really excited to be here talking with you about the principles and application of risk communication, particularly when we are communicating science in uncertain times like pandemic. So just going over what we're going to go through today, we're going to do an introduction to CERC, which is Crisis and Emergency Risk Communication. So I will be calling it CERC. You'll hear me call it that over throughout the presentation. We're going to look at the principles. We're going to look at the psychology of a crisis, how your brain works, how the principles of CERC really help you work through those issues and challenges for people hearing you in an emergency, and how to apply the principles through science communication, and then we'll facilitate a group exercise afterward. So we want to, again, understand the basics of crisis and emergency risk communication, apply the CERC principles to immunization work, and really kind of talk through the importance of science literacy in this entire process. So what exactly is CERC? It stands for Crisis and Emergency Risk Communication, and it's a method of communication that has been really embraced by the public health community, starting with environmental health, and really over the last 20 years or so into public health more broadly. There are different names and different applications for it. WHO, for example, often incorporates community in their risk communication principles and how they frame it and discuss it. I think that's a really great way to approach it, because it gets to, one, the idea that this is about community engagement at multiple levels, and it's also about really working and thinking about this work in risk communication, not only in terms of how you communicate, how you get information out, but really in terms of your ongoing programmatic implementation around immunization programs, as well as other aspects of community engagement. Sort of in the same way that you would look at social media, not just as a one-way communication tool, but much more of a public space or public forum, like a park or a library or community gathering space. So when we look at an emergency, a crisis, people react differently. They think differently. They search for information differently. They take it in differently, and they process it differently, and they act on it differently. So this really gets to our brain working under stress, where we simplify and limit the intake of information. We cling to our beliefs or habits or our friends, and we really kind of go back to what our previous experiences are. In an emergency, it's really tough to learn new things, but people are, but they're looking for confirmation, information, things that can help them act. And in those situations and in emergencies, one thing that is really important in all of this also is that the myth of panic. When our brains are under stress, we're not necessarily going to go out and have this incredible panic, but we're really going to look for something to do. And we'll get to that. So when we're under stress, some of the psychological barriers that we have to messages and messengers can be everything from fear, denial, anxiety, confusion, dread, hopelessness, helplessness. And you can experience this, individuals can experience this in different ways and manifest these things in different ways over the course of the emergency and over time as well. So what does risk communication do? It really creates a framework for creating and maintaining trust in an emergency, in a crisis, and really in a lot of day-to-day activities. It's a method to acknowledge and communicate in uncertainty and through uncertainty, way to coordinate messages, coordinate language, way to really kind of be transparent and fast with your interaction and communication, being proactive and involving and engaging. And I think this is really one of the most important pieces, the people who are affected. And really kind of looking at that in the 6 basic principles of CERC. So being first, being right, being credible, expressing empathy, promoting action, and showing respect. And those of you who have backgrounds in health education and promotion or behavioral science, for example, will see a lot of these things kind of centered around concepts of self-efficacy and ensuring that people feel empowered and connected and engaged and valued in an emergency. So when we get into the best practices of how to implement those 6 basic principles, what they do is really kind of allow people the right and the space to feel fear and concern. It allows us and gives us a mechanism to be clear and direct and confident in our communication, but not to over reassure. Acknowledging uncertainty. This is what we know. This is what we don't know. This is what we're doing to gather more information. Here's how you can help. And really giving people, again, meaningful things to do. It's a way that as people process information throughout a crisis, it gets them a way of thinking through that we're, as agency, as organizations, institutionally, over-promising and under-delivering. And it's an approach, again, that can inform all of our public health activities. So really kind of take a minute to think through these. Mixed messages, multiple experts, information being released late, paternalistic attitudes, failing to counter rumors and myths in real time. Real time's important. And then the public power struggles and confusion, which kind of goes to the mixed messages and multiple experts as well. Take a second and just think about the last 2.5 years. And even thinking about recently the monkeypox outbreak, where you might have seen some of these failures in the operation or the rollout of the communication and the engagement with the communities around those 2 emergencies. So one of the things that we like to say around risk communication, the right message at the right time from the right person can save lives. And 2 of the things we often, when we're thinking about communication, we stop at the message part and say, man, we've got this message, it's perfect, it says everything we need to say, let's get it out and everything will be fixed. But the timing of it is really important, and the person, the messenger, it can make or break whether or not something works. And this going back to thinking about media. And if you think about, somebody who is empathetic and relatable, standing up at a press conference or at an event, really connects to and provides humanity to your organization. Think about that in terms of a social media space and building a mechanism or system of trusted messengers, influencers, people to engage, and empowering them with the messages and the information that they need, and getting it to them in a really timely way, in a coordinated way, ensuring that they, as trusted messengers, are able to share, and making sure that that continues to flip so that you are hearing information and getting feedback from people in the field, your trusted messengers on social media or in the community, and responding to those things in a timely way. Again, the right message, the right time, and the right person delivering it. So now that we kind of have this picture of risk communication, let's get a little bit into science communication and science literacy. This is one of the biggest challenges I think that we face, where basic scientific knowledge, scientific understanding is incredibly important to nurture in the trust building process. As we have trust in science, we also have to have trust in scientific institutions, and as public health, as healthcare, and other scientific institutions. It's really incumbent upon us to build those relationships, help people understand science, help people understand the scientific process, the terms that we have, and how to get that information into society through our partnerships. The way that we do things in terms of implementing scientific communication around immunization is it kind of starts in this process where we go through the science of the vaccine, all of the clinical trials, put all of that information together, then sort of roll that out to within the scientific community as they process it, and as we implement vaccines and vaccine recommendations, then goes to the clinical community through scientific literature, through rolling out of new guidance and having lots of sessions where we have a lot of interaction so they understand the science and then are able to translate that science to their communities, working with health departments and our healthcare providers, staff, and others. And then that, as we kind of work through it, that science about vaccines really begins to integrate and work into the basic knowledge base and decision-making process of the community. So there's really a very deliberate process in how we do scientific communication at CDC around immunization. And you saw a lot of that happen very quickly, all on top of each other over the last couple of years as we rolled out COVID-19 vaccines. So the literacy component of this is understanding the terms, the concepts, and the nature of science, and how that not only interacts with society, but also the individuals, and where all of those things connect. And I really like to think of science as a process, and a way of understanding and a way of questioning and improving from mistakes, failures, lessons learned. And so when we are in a crisis, it's very hard to explain that and deal with that level of uncertainty when we have an emergency, because you're really kind of dealing with and gathering information to share that with people to make better decisions. And in an infodemic, it's even more difficult because people are completely overwhelmed with information. And so with social media in an infodemic, it's really difficult to kind of cut through the noise and explain science to people in real time. So it's incredibly important to nurture those relationships with your trusted messengers, with your community members, with your community leaders, and other partners outside of social media to help make sure that they understand what's going on and can support that trust building process in their communities. One of the things that we've really kind of begun seeing as we talk to our partners and really kind of look at implementing more infodemic management work at CDC and with our partners is understanding that it is really easy to undermine trust in science and institutions with social media, but it is really difficult to build that confidence, that trust in institutions and that scientific knowledge just with social media. Got to really do the groundwork first and connect with the communities to be able to really use the power of social media for good in those situations. And when we talk about the science literacy aspect of this and the trust, it really serves as that foundation building trust and confidence in the scientific institutions, facilitating understanding of how the public works and reduces that susceptibility, having that appropriate understanding of how to make evidence-based judgments, and also having some empathy and understanding for what we're going through as we're communicating things in real time, as we're learning them ourselves. So looking at this sort of this process in the context of COVID-19, identifying what the most relevant information is, knowing that that is constantly evolving, so you're going to constantly have to update that, determining what people already know, what the gaps are through social listening, through surveys, and through, frankly, just interaction and making sure that you are connected and using social media and your other tools to stay connected with the community. It's really difficult for those of us in a response situation to constantly think about how do we communicate and connect with people like our grandparents, our friends, our family, our neighbors. But ultimately, that's what we're trying to do. How would you reach them? How would you communicate with them in those trusted relationships that you have? And so designing the communication to fill those gaps, using that context, using all the principles and knowledge and experience in risk communication and through the infodemic around complicated issues, acknowledging uncertainty and really kind of chunking out that information in really small bites so that people can process it. And then we want to evaluate. This is really a constant ongoing process because every day, every half day, every couple of hours, our messages are going to have to change. So through that process, using social listening, staying connected with maintaining and understanding the things that are affecting trust from the public and their activities and how they're reacting to the recommendations and suggestions that you're making to them around things that they can do to really be helpful and stay empowered. And again, constantly evolving. So this process is constantly moving, constantly changing. And honestly, the hardest part of doing this is making sure that we're getting out those simple, clear, direct information, bits of information in ways that people understand it using the scientific clearance processes and bureaucratic clearance processes that we have to go through, even during a response when those processes are streamlined or shortened, becomes even more important. So constantly making sure that we're honing and improving what our messages are so that they're relevant and useful to the people we're trying to reach. Great. So as we go through all of this, the metrics and evaluation are not only something that we go through constantly during the process, but there's something that we have to look at really after action and really apply the scientific process of learning from and examining our successes, failures, challenges, and then implementing them, figuring a way to implement them in our regular program, and also implement those strategies and approaches in the next emergency so that we can prepare for it. So that includes evaluating every aspect of the response, looking at the effectiveness of different tools and different resources at different points in the emergency, documenting those lessons learned, and identifying sort of where the challenges were through those processes and trying to address them. And then just determining those specific actions to improve your crisis plan, and then creating those linkages and pre-crisis activities. In a response, we like to say you don't want to exchange business cards, using a term because I don't ever like to exchange business cards. I don't even carry them anymore. But you don't want to exchange business cards or meet somebody from the first time in a crisis. Because again, it's challenging to build new relationships when you're under that kind of stress, going back to the psychology of a crisis. So throughout looking at different sorts of tools and resources for communication, we think of this often as ways that we're pushing out information, updating websites, using social media, getting out and making sure that people have consistent places to go for information. If we're not consistent with the information that we put out, it makes it much easier for sources of mis and disinformation to gain hold. So keeping that process going and working all the time, creating newsletters, blasts, PSAs, fact sheets, billboards, all of these tools are incredibly important. at different points in an emergency. So we set up, for example, new newsletters and email blasts on a regular basis as we were expanding and changing our vaccination recommendations as people were implementing vaccinations at the health departments or with clinicians. New vaccine, new processes, making sure that everybody is doing everything right and making sure that they're following all the rules. And so getting that redundant, repetitive way of getting out information is incredibly important. Over time, also making sure that we have advisory groups to gain information, community forums to gain information, having hotlines or methods for people to provide information to us so that we understand the questions that are in the community and things that are going unanswered or where there's mis and disinformation starting to start trends. So here's a number of resources, the Crisis and Emergency Risk Communication book for CDC, the Emergency Risk Communication tools from WHO, and a number of other WHO resources as well. So thank you very much for listening, and I'm really excited for your opportunity and enjoy your exercise. Thank you.